burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Good evening. I presume that I am on. A pleasant good evening to you. This is Dr. Gerald Thompson, and it is Your Health Matters once again. I always project that this show is interactive and that we try to stay on current topics. I remember you could call in any time, 457-9997, both straight call and also in relation to WhatsApp. Now, I thought I'll dedicate this program to the subject of COVID. Yes, COVID. Recently, I've been listening to a number of commentators that have been trying to make the case that they took the COVID vaccine, but they believe that the COVID vaccine is affecting them. And they have no evidence that they caught the virus. In other words, the vaccine may have worked in preventing them from catching COVID, but that the vaccine itself was affecting them, and they've been feeling tired and weak, and they haven't been feeling themselves ever since they took the vaccine. And so as a result, there must have been something wrong. Just a matter of a couple of days ago in the United States, the new recently appointed human Secretary of Health, the Secretary of Human Health in the United States, he literally fired the Vaccine Advisory Board, the 17-man Vaccine Advisory Board, which he said he was not going to do. And he is going to appoint his own board. And this board basically has some impact in relation to St. Vincent and the Grenadines, in that they tend to influence the type of flu vaccines and other vaccines and so forth that are approved and developed. It's important that Robert F. Kennedy had been saying he wasn't satisfied. Well, he'd been battling with these particular entities, making the case that not so much COVID vaccine, but a lot of other childhood vaccine, measles, mumps, rubella, were also the cause of problems. So the reason why I need to talk about this today are for these two reasons: that what is taking place in the United States is certainly going to have some impact over the next months and year, and probably some time to come. And additionally, that individuals in respect to COVID vaccine are claiming that the COVID vaccine is affecting them, and that they may have proof of this, or that they heard from various other doctors and other specialists and so on, that may be the case. Now, I am an infectious disease specialist, as you know. I'm not a practicing infectious disease specialist, but the subject is something that I do know a little about. Now, it's important that we establish some framework. The most prevalent cause of death today is what we call heart disease. The various forms of heart disease, that is heart attacks and heart failure. But over the last 20 to 30 years, the two diseases that has been seeing meteoric rise is firstly diabetes. Diabetes was like number 30th on the list a matter of 2-3 decades ago. Well, it entered into the top 10 of diseases somewhere around 2010. Now it lies at number 7 or number 8 and still rising. Another disease, Alzheimer's, is also a rapidly growing illness that is not so well understood. But these things are all very much linked with each other. I must tell you that diabetes, one of the most common ill effects of diabetes is that of heart disease, loss of brain function. In other words, diabetes is a small blood vessel disease. It starts to cause clogging up of your small blood vessels. So the tiny blood vessels that go into your brain, go into your eyes, go into your kidneys, go into your toes, go into even your sex organs, your penis, in the case of a male, these things are going to be significantly affected. And over a period of time, you're going to see decreasing function and ability to really have these organs run. And kidney disease, I mean, over a 10, 15 year, 20 year period of having diabetes, you are going to see people, especially if the diabetes is not fully controlled, approaching that of kidney failure, renal failure. You're going to start seeing persons not so much having heart attack, but their heart function is going to start to deteriorate over a period of time. But this program is not so much about that. We know that in the end of 2019, 2020, we experienced the COVID pandemic, and that it significantly affected the world. There has been over 7 million deaths throughout the world. In St. Vincent and the Grenadines, we had 160 plus persons who died. 160 is one of the lowest in the Caribbean. And at other islands, other countries would have experienced deaths in the thousands. Now, there was the development of vaccines, and vaccines were developed in China, and that area in Asia predominantly had Chinese vaccines. There was vaccines developed in Russia, some developed in India, and those very large continents also utilize those type of vaccines, along with the vaccines that were developed in the United States. As we know, the Pfizer and others. Pfizer was probably one of the most commonly used, as was also the AstraZeneca. Now, all these vaccines, and if I said virus, I meant vaccine, but all these vaccines were tested over a period of time, a relatively short period of time, but still tested. And the pandemic was, as we recall it, killing people. And some persons were of the opinion that we should wait 5 years, 10 years to even start using the vaccines, because in the past, it has taken that length of time to be able to assess different and certain drugs or get their approval. And they disagreed with the emergency approval of these particular drugs because they felt that it may not have been tested long enough to see if there were the side effects and so on. Bottom line is that some of those individuals still firmly of the belief that vaccines should not have been used at all for another 10 years, that we should have gone through a 5, whether it's 3, 4, 5, 6 to 10 year period of time, waiting and hoping that the COVID went away, or hoping that other methods, natural methods, could have been used, because clearly any new drug in a similar to vaccine would have had to take 3, 4, 5 to 10 years to be approved as well. And that they didn't agree with the emergency method by which these vaccines were approved. Now, let's just fast forward a little bit. Besides the 7+ million people who died, today, there's still each month approximately 1,000 people around the world who die of the vaccine, of the virus. Let me repeat it again. On the United Nations database chart, the evidence is showing that there are still substantial amount of cases of COVID that are reported on a monthly basis, on a daily basis. And that the number of deaths, when compared to that of the first few years of the pandemic, is far, far lower, but still substantial. For that matter, health professionals and public health authorities hardly talk about COVID today. The COVID pandemic, I would say, stole a lot of attention away from the diabetes and from the Alzheimer's and from the heart disease. And many authorities were eager, many ministries of health were eager to get back to dealing with these type of conditions, because those conditions were also killing people in their own right. For that matter, persons who had these illnesses, diabetes, hypertension, kidney disease, all sorts of other, what we call predisposing factors, as we call them. And that term, really, they had illness. They were sick to begin with. People who were obese, they were the most severely affected by COVID. And COVID had the ability to infect some people in a very mild way. Some people didn't know about it. It was asymptomatic. They caught the COVID, but they didn't know. Some people caught a little sniffle, a little stuffy nose, a little runny nose, a little fever for half a day. It went away. Others, you would say, did have it mild, they had fever. Other people were quite sick. They weren't hospitalized, but they stayed at home and they recovered, while others basically got very sick. They had to be hospitalized. They started having serious complications. I remember some people lost their taste, lost their sense of smell, but it was those who started getting shortness of breath. It was those who started having all sorts of other symptoms of fatigue, and many who had to be in the intensive care unit, getting drips, getting fluids, and a number of persons died. I said over 160 persons here in St. Vincent. Across the region, we lost well over 1 million people. Right? No, sorry, across this, we lost tens of thousands of people. And in the United States, of that 7+ million globally that lost their lives, there was close to well over 1 million persons just in the United States alone. Now, there was another factor. Those persons who did not die, a number of people developed a very strange and unusual condition called long COVID. In other words, it was as if the COVID, they got over the initial bout, but the COVID never really went away. And you remember an illness like chikungunya? People used to complain of having a stiff neck and back pain and so for weeks and months. This is not uncommon with a number of illnesses, viral illnesses, Zika, chikungunya, even many of the flu viruses and so. But COVID was causing a very strange phenomenon of long COVID. Many persons could not recover from the ringing in their ears. They couldn't recover from the loss of taste and smell. People were having brain fog, loss of memory. People were having persistent shortness of breath. It wasn't killing them, but they were having these series of symptoms. And this program isn't so much about long COVID, but it's estimated that of all the people who got COVID, about 1 in every 10 would have gone on to develop long COVID. It's estimated that 400 million people around the world, they basically developed long COVID after receiving COVID. Now, 7+ million deaths, 400 million plus with long COVID, who have experienced long COVID, but with long COVID, some people were able to recover. It's like the illness went away on its own. There wasn't a specific treatment. You could treat the specific thing, the loss of taste. You could start putting sugar in your mouth, and you could start salting up your taste. A lot of people did some very strange things. But if you had long COVID, or you still have long COVID, you belong to a group of persons where, yes, after 3 months, after 2 years, after a period of time, the long COVID might have gone away. And at the same time, for a percentage of individuals, it seems the long COVID never went away. Now, what and why was this virus so effective in causing these type of things, whether death or long COVID? Well, truth is that there were other viruses that caused far greater death rates than COVID. The Spanish flu, smallpox, all these kind of things. During their heyday, they basically might have killed 30, 40 million people. When you study pandemics over the last 300, 400, 500 years, you start to get a big understanding of really how and why these viruses killed people. And even in these modern times, when there may not be great treatment, and yes, ginger and turmeric was wonderful. I drank it. It's beautiful. But it wasn't necessarily going to cure. The anti-inflammatory properties of ginger and turmeric is wonderful. But for some people, it wasn't going to do the trick. And let me explain why. You heard me talk about this before. COVID belongs to an elite group of illnesses. They cause the body to do some strange things. Other illnesses were the plague. Now, many of you may not know a lot about the plague. The Spanish flu, something we call septic shock. I could go on, but a very small number of diseases. What these infections and so do is that when they get into the body, your immune system says, what the hell are you doing here? My gosh. And with most infections, the body says, okay, I'm going to take a piece of paper and I'm going to swat you like swatting a fly. Come out. A fly's on my hand. I'm going to deal with that. Your immune system, which is part of your body's defenses, has a way of being able to target those particular type of infection, most infections, and handle it. But with this selective group that COVID belongs to, plague and so forth, they cause the body to say, what? And the body, you've heard me say it before, starts to throw mud, sticks, stones, bullets, grenades, bazookas, bombs. It throws almost all elements of its immune defenses at the virus. And that is analogous to having a fly on a glass table, and I could be able to take a little thing and hit it, but instead I am going to take a sledgehammer, I'm going to take a gun, I'm going to fight at a glass table. I might kill that fly, but I've also destroyed the glass table. I've destroyed anything under the glass table around it. This is something, a technical term called a cytokine storm. The immune system just, there's a storm in a teacup, and basically the immune system just goes wild. Why does that happen? We've not been able to determine that. There's some good reasons why, but this program is not about that. What I'm getting at is that when our immune system tries to get at the virus, it's also attacking the kidney. It's attacking the heart. It's attacking the liver, the lungs, this, the other. It causes so much collateral damage, so much ricochet, that these individuals really go. Now, who gets affected? Not everybody. Not everybody gets affected. It could be somebody who's fit, somebody who's been drinking the turmeric and ginger. We've found that, though, people who are obese seem to have been more severely affected. We realize, too, people who might have had diabetes and high blood pressure and all these kind of things were more severely affected. People who might have had cancer, the immune system was off. But the bottom line, you did not become severely affected because your immune system was weak. I'm going to say this again. It isn't because your immune system was weak and deficient. For many people, it was because their immune system was too strong. The immune system was just too overreactive, ready to fight. You know, somebody comes and says something, you insult you, you're ready to fight. You're ready to smash everything up, smash up this whole studio. Now, I've been putting things in very simple terms because on one hand, 7+ million people died, and you had close to almost 400 million people with long COVID, who many of whom recovered, but many who still continue after 3, 4, 5, 4 years after COVID, still have persistent symptoms, chronic fatigue, brain fog. Now, the virus, the COVID virus itself, do you know one of the main illnesses it causes? It is one of the most profound causes of clotting inside the blood. People who got COVID, the way they died, many of them died of a heart attack, of a stroke. They died of clots here, there, and everywhere. And the ability of the COVID virus to cause blood clots was profound. Now, there's no doubt that at least one of the vaccines was also noted that on rare occasions, it also may have induced clots. That is true. But it was not just night and day. The incidence of clots as a result of vaccine was so small compared to that of the virus itself. And the discussion that took place really allowed persons to become fearful of the vaccine as causing more harm than the virus itself causing people harm. If a virus, the COVID virus, were to kill over 7 million people, cause chronic, long-term, long COVID for over 400 million people, the incidence of side effects from the COVID vaccine itself is also, I must say, fairly sizable, in the sense that we assess if you have a redness at the injection site where you got the vaccine, that's a side effect. If you experience some pain or some swelling, that's a side effect. If you got fever and this fever seemed excessive, that's a side effect. If it made you feel funny and so. Now, there were some rare side effects where it might have caused what we call myocarditis, an inflammation of the heart. There was a situation where it might have caused Guillain-Barré syndrome, another kind of immune overreaction. But all these conditions were still relatively small compared to the number of people who died and the number of people who had long COVID. And let's leave out the number of people who basically were unable to work, were unable to of course, you know, during the COVID pandemic, not many persons would have been effectively working in the same way, working from home as well. But the way it happened, don't talk about the depression. Don't talk about all those things that came with the pandemic itself. And we could go on and on, all kind of side avenues of discussion. But the core discussion is looking at the relative picture of persons who took the vaccine and persons who did not died and those who developed long COVID as a result. What's more complicated is that the vaccines were not 100% effective. And that those individuals who might have taken the vaccine, if the vaccine was 90% effective, that means that if 100 persons took the vaccine, 10 of them would potentially still catch the vaccine. And with some, catch the virus, sorry. And with some persons, if they took a vaccine that was 80% effective, that means 20% of every 100 could still catch the virus. The thing is that, I mean, I am an individual. I took the vaccine. I was probably one of the second persons here in Sydney to take a vaccine for COVID. And I got several boosters. And I took my boosters, first of all, fine. And then because I had to go to the United States wanted to know that you're taking the Pfizer. So I took the Pfizer too. But by that time, I would have known I was not one of the individuals who was going to have a cytokine storm. My immune system was not going to overreact. I didn't have the underlying illnesses or the predisposition to overreact. But and so in terms of my need to take the vaccine on a continued basis, I got the basics of it. Now, for many persons, they also were subject to a lot of rumors. And I'm going to take a break here. We can recognize the sponsor of People's Pharmacies and come back and I'll dig into it later.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. Now, a lot of studies have been done about people's attitude towards diseases. Truthfully, the trend has been to use more natural stuff. There's nothing wrong with that. That's great, wonderful. Whether that will prevent all illnesses from happening, whether that will prevent all the cancers, all the heart disease, all the diabetes. Unfortunately, many of us have not been using those practices since the time we were young. We may have only recently started to do that, and the damage would have been done. So that I started off mentioning diabetes. If you're diabetic, if you are a person who have experienced prostate cancer, if you're a person who has high blood pressure or heart disease, the likelihood is that you may not have been properly taking care of yourself or screening for a fair period of time. And that many individuals who I have found with diabetes, for a period of time, they have denial. They have denial. A high percentage of individuals who are diagnosed with diabetes and hypertension do very little about it. They continue doing the same things until they have an episode. They have something that really shocks them into now paying more attention to their illness. And that is a serious concern. That denial sometimes manifests itself that you wonder if somebody been putting something in your tea. You wonder if somebody did something to you. You often will not blame yourself. You blame your wife. You blame your significant other for not taking proper care of you or preparing meals and so forth. But really, it was a lot about you. And it's important for you in terms of changing behavior that you recognize that it might have been you. And once you're able to get over that hurdle, you're ready to make the necessary changes. There are persons who might have diabetes and they're not feeling well and may think that it is the COVID vaccine that is affecting them. Well, if they do have a physician, I'm hoping that physician is telling them it's probably not the vaccine, you know. It's probably that you are not, or you're still not properly addressing your diabetes, addressing your hypertension, addressing your heart disease that did not develop in one go, that did not develop in a week, that you were fine, you were wonderful, you were really well. You know, you were 19 years old all the time and not 70 years old as you are, or 65 years old. You had a 19-year-old body and the vaccine turned you from having a 19-year-old body at the age of 65 or 70 into a 70-year-old body. No. The chances are that these problems have been developing over a period of time. The diabetic small blood vessel disease was there developing almost 10, 12 years before, building up, narrowing some of the blood vessels in your heart, doing all these sort of things. The chances are too, if you have got a vaccine, that when we do the blood tests, we have to be very careful, because unless you do the right blood test, it may not necessarily show up as the fact you have an acute infection. In other words, you have a current infection. You may have had an infection before at some point in time, especially if you're a person who moves around. You may just be one of those individuals that the vaccine did not 100% protect you against catching the virus. And that you yourself may also be experiencing long COVID, you know, and I've met so many persons who are a bit like that. That it's either that their own underlying illness, their diabetes, their high blood pressure, is actually not being properly taken care of. Not as the doctor, but you as the individual have not been able to effectively address those particular issues so that you could get ahead of the game and properly control the diabetes to an extent that it is not slowly causing further deterioration in your health. If you have been able to do that, if you are accomplishing that, that's wonderful. That's a very important start. But the first important is you have to have the insight that the diabetes is a serious illness and that you need to address it. And today, I've told you diabetes is now in the top 10 of causes of death, causes of mortality. And if you have a double whammy of diabetes and high blood pressure, then it's even higher. Now, there's no doubt in my mind that the vaccines would have created some element of a range of effects, side effects with a number of people. They're the more severe ones, and I've mentioned to you some of the milder things that come with almost any type of injection or medication that's being given, the side effects that might come with these particular things. In the case of vaccines, these things are already noted. They say the rash, swelling, pain, all those particular type of things. But what is clear was that there was also these very rare side effects. They weren't common at all. And that must be recognized. But that has to also be compared with the deaths. And the research and the studies have shown that the vaccine actually may have saved close to 200 million lives around the world. It's my view that drinking turmeric and ginger and all these other things and being healthy is wonderful. But I've pointed out to you that being healthy did not necessarily stop your immune system from overreacting, from going overboard to try and get rid of the virus once you were exposed to it. That has been that problem. And that's something that's difficult to explain, difficult for people to understand. What's easier for persons to understand was the rumors that within 6 months, right, millions of people or everybody who took the vaccine was going to drop down dead. Then that changed to 1 year, 2 years. We have not seen deaths. There are people who say, well, boy, there are more deaths now than there were before. It must be the vaccine. Well, I tell you, one of the areas that we study is also in disasters. Do you know that in Puerto Rico, it was 10 years ago when a hurricane went to Puerto Rico, they reported a number of deaths. And then they found a lot of people were dead in their homes, but they hadn't reached them. Little villages. But there's another source of death. In the weeks after the hurricane, in the weeks after any disaster, we start to see increase in deaths too. From people, not people who were cut by galvanized or people who were crushed in their homes. I'm talking about people with high blood pressure who smiling at you, but their blood pressure is so high that they suffer from strokes after. From people who their medication got lost, blown away, damaged. They're not taking their medication because they're in a shelter and no doctor's seeing them and so forth. So in the weeks and months after major disasters, we also see significant rises in deaths and mortality. Soufre, burial, all these things would have had their effects. Every single hurricane you see, go through Florida, go through New Orleans, go through Southeast Asia, has this phenomena that a number of people die after. But of greater importance is when the attention is given to COVID, when the attention is given to the relief program post the hurricane, and that there isn't the supply of doctors and nurses and the detailed attention that patients used to get before, the attention that people used to get before, we also see that if you're not in the 3 years after a COVID, if you weren't getting your prostate checked, then guess what? A few of you would be detected to have prostate cancer. We didn't have the time. That a swelling that arose, a bump that arose somewhere in your chest or so that you ignored, turns out to be a cancer. We see this sort of situation all the time, and these things account for the increase in death. But also, COVID itself continues to cause death. It may not necessarily be a significant increase in St. Vincent, but we've had our increase. And COVID may even continue on catching it to induce things like strokes, to induce things like heart attacks and so forth. Now, I thought it important to go over this. Public health officials have stopped talking about COVID in the way that they used to talk about it every day and bore people. Kamal, you were fed up of hearing about it. And you wanted, you tell me, let's move on. Let's talk about something else. But people who were against COVID vaccine continue to talk about it. And it isn't getting that sort of balance because, rightly so, the people in the public health have moved on, moved back to trying to get people to do their pap smears, to check their breasts for cancer, to check their blood pressure, to check their blood sugar, to check on all those other public health issues that were being ignored and could not be addressed during the time of the pandemic in a sufficient way. So that you basically are able to have a sort of balanced, healthy lifestyle instead of the focus on one disease. But it's important for me to come and just really establish that contrast. The COVID pandemic, the pandemic in itself is over. It's no longer an emergency. It's optional whether you want to wear a mask. Somebody may laugh at you while you're wearing a mask and so forth. You basically have to feel comfortable. Whether a mask works or it doesn't work, you basically can feel quite comfortable in what you do. But the use of vaccines, whether it was for COVID, whether it's for measles, mumps, rubella in childhood and so forth, has been a damn good thing. And I do believe that the evidence shows it did save lives. In St. Vincent, we were quite successful. We were quite successful in reducing the number of deaths. You know, and not only reduce the number of deaths, but even though there is long COVID here in St. Vincent still, and people talk about it all, I see it. I've discussed this with a number of patients who I know have long COVID and are still suffering even after this time. And those who've been able to recover from it and are now relatively back to normal. But how it has left them, whether it has still left them with an element of still mild levels of inflammation in their bodies, the effects of the virus, and I want to say the long COVID is predominantly due to ongoing inflammation. The immune system still trying to get rid of the residue and the relics of the virus in their system from persons who caught COVID whether they did not take the vaccine or they took the vaccine and the vaccine was not 100% protective of them, that basically the immune system, they're one of those where the immune system is still reacting, still uncomfortable with the fact that COVID active, still in moderate, not in high gear, but moderate gear and causing all kind of things. It may not be sufficient to induce long COVID, but it is still having some effect, you know? And I have no doubt in my mind that besides diabetes and high blood pressure that causes stroke, those individuals who were also exposed to the virus, that is having a component in terms of helping with inducing strokes and sort of other illness. We, around the world, I am convinced that we would have saved, as is estimated, over 200 million in deaths, right? And that currently we've only had close to 7+ million deaths. And that if the pandemic had been allowed to run and say vaccines, you can't be used for 10 years, you can't be used for 5 years, you can't be used for whatever somebody has said is the correct length of time that you could you should wait, you know, that basically we might have achieved and reached 200 million deaths, or somewhere a fraction of that. Still, that is a significant amount. And that the number of persons who still suffer from long COVID, that would also have been even higher. So it is something that we have to reflect on, and those individuals who themselves may believe that is the vaccine that is currently causing their illness. It may be that could be true, but you have to make absolutely sure that if you have diabetes and hypertension and you have some other underlying illness, that those underlying illnesses, especially diabetes, is controlled, and that you are not fooling yourself to say, I'm all right. It's just the vaccine that caused this. And that it's not the diabetes. I want you to dig a little deeper, have much more tight control of that sugar. Don't let that sugar start running anywhere in an elevated form. Get that strict control. And if you've had a heart attack before, and you've had any kind of evidence of a stroke, chances are you need to assess that a stitch in time saves 9. And you need to really effectively address this in some major way. I thought I'd speak tonight on this subject, Kamal. You know, I know that people have been talking about this over the last few weeks, and I'm not talking specifically about any particular person or any particular individual, but I thought that it was important that we address this. And people will tell you otherwise. You know, vaccines are bad. Don't take none. Take this instead or that instead. I'm a big proponent of natural medicine, of bush. But I also believe in allopathic, what is called standard general medicine too. I'm not going to go one way versus the other way, but to understand both fields and to know what is appropriate, what is necessary, and in the most severe situation, what you need to do. So, ladies and gentlemen, let me bid you a pleasant good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on